Ladies and gentlemen, welcome back to the channel. I'm Dr. Dawson, and today we are going to approach a topic that is a little bit complicated, a little bit maybe long-winded as of today, but it is very important. So today we're talking about arthritis in dogs. Primarily, a lot of this does transfer over to other species, however, so don't let that get you down if you're like, oh, I'm worried about my cat or I'm worried about whatever. A lot of what I'm going to talk about today, which is how arthritis happens, why it happens, what it is, all of that kind of stuff, is going to apply very closely and strongly to many of our other species. And the reason that I'm picking mostly on dogs is that this is one of the most common conditions in dogs, affecting approximately 20% of all dogs within the US. The more a group of dog ages, the more likely they are to have osteoarthritis at some point in their life. So this is a very common disease, and it does affect a lot of pets in the country and across the world. I'll do my best to explain the technical aspects of osteoarthritis in the simplest terms that I can. However, this is a very complex disease, and the better understanding owners and veterinarians have, the more likely the patients are to have a successful outcome and successful management of this debilitating disease. The shortest explanation of osteoarthritis is that this is inflammation of the joint leading to permanent changes to the structure of the joint, which this causes pain and a loss of function within that joint. I'm just gonna preface this, guys. If you don't want the technical explanation, you don't care, you don't wanna learn about this, go ahead and just hit the subscribe and notification bell, because we're gonna be exploring this topic with more practical things here in the future. But I think this video is important because the more you understand it, the more our management techniques are going to make sense to you. So just wanted to preface that. If you don't wanna watch this video, I don't blame you. It will probably be long and very technical in some ways, but I will do my best to explain it in simple terms. So what is inflammation? So the first part of my statement, inflammation of the joint. Okay, so what is inflammation? And I want you to answer this in your head. And so just take 2 seconds here, answer that question in your head, because I think maybe we'll actually change some of that definition here as we go along. I'm still waiting. You have it yet? Okay. Put it down in the comments so I actually believe that you took the time to explain what inflammation was, and don't just Google it, please. You can if you want, but it won't do either of us any good. So inflammation is injury or death of cells leading to an organized cascade of fluid and cellular changes within vascularized tissue. That is, tissue that has blood vessels present within it, leading to an accumulation of fluid, electrolytes, plasma, proteins, and white blood cells. Clinically, so like what we're gonna see as clinicians or as veterinarians, and even you as owners, we're going to see this as swelling, redness, heat, pain, and loss of function. So think of the last time that you got a cut. It got red, it got hot, it was swollen, and it took a little while to be able to function again. If it was on or near a joint or a movable part, that part of your limb probably didn't move as well as it normally would. Often inflammation is good. So the body has a goal of isolating, eliminating, or diluting the cause of an injury, whether it be getting rid of dead cells, clearing some sort of infection, or diluting or isolating some sort of toxin. So some examples of this would be killing or sequestering dead or infectious foreign material, or even cancer. Degrading foreign material. So think about the last time that you had a splinter or a sliver in your hand, and it created that little fluid pocket around it and helped work it out. So you could actually remove that foreign object. Providing nutrients to wounds. So think of that clear, thick fluid when you get a wound, or if you've seen a wound, that's often going to contain things necessary for the body to be able to heal that wound or heal that injury. The other thing that inflammation can do is that restricting movement of a limb or appendage to allow for healing is a really good thing, because think about if you damage your bone, so you hurt the bone in your finger and you move it around and it breaks further, and then it breaks through the skin and it gets infected. But if it's swollen and painful and red, that joint isn't going to move as much, your muscles aren't going to function normally, but it's also going to often protect that wound so that it's able to heal from the inside out. Inflammation can be detrimental to the body as well. Many different diseases are either started by inflammation or made worse by inflammation. So in humans, we've identified quite a few different types of diseases that can cause inflammation, including COPD, Alzheimer's, Crohn's disease, rheumatoid arthritis, cystic fibrosis, asthma, osteoarthritis, and many, many more. And a lot of these are going to apply to dogs as well. Maybe not the specific autoimmune disease, but often we're going to see inflammation leading to furtherance of a disease in animals, whether it be dogs or other species as well. So the body's trying to react with inflammation to help control whatever insult is there. It overdoes it or causes worsening of it. And so we get a new disease condition that wasn't there previously. And it's primarily as a result of whatever that inflammatory response is. So far we have talked about acute inflammation, which is basically fast and short inflammation. So less than a duration of a week, occurs very quickly. However, acute inflammation by itself does not cause the changes that we see in osteoarthritis, but something called chronic inflammation does. So chronic meaning that it's further than a duration of a week, but we use it in a lot of different ways in medicine, and so don't get too hung up on this definition. But essentially the process is different, as in it's not going to necessarily have those same changes, and a lot of them are going to be a much more permanent changes that we see due to this chronic inflammation. Chronic inflammation can occur for a variety of reasons, including, but not excluding other things, very long-term acute inflammation. So if there's an injury that just continues to get worse and worse, or if there's an infection that's there for a long period of time, those can cause chronic inflammation to get started. The other thing can be repeated onset of acute inflammation in that same area or body system. And this can happen for a whole host of reasons that I'm not gonna get into at this point, but just suffice to know that there's many different ways that chronic inflammation can kind of get started. But the two are very different, but they're interdependent in a lot of different ways. So basically, chronic inflammation is seen clinically as the body trying to put down new structural tissue. And this could be trying to wall off a chronic infection like a fungal infection, creating an abscess, or even thickening of tissue with fibrosis for a variety of different reasons. Let's get into something a little more specific. Now that we know a little bit about what inflammation is, let's get into what exactly in dogs causes inflammation of the joint. So in dogs, the joint is what's going to be inflamed when we see osteoarthritis. And the same goes for humans, the same goes for just about every different species. We see this joint inflammation occurring for a variety of different reasons, including joint instability, joint infection, and even joint injury. So let's start with joint instability. Joint instability happens when there's excess movement in the joint. And the body's gonna start this inflammatory process in order to try to restabilize the joint, thereby causing a lot of these changes that we'll talk about in a second. But joint instability can happen for a variety of reasons. So it can happen because of an injury. So if you have a rupture of a ligament, such as the ACL, this is going to allow the knee joint to be able to move back and forth in an abnormal manner, causing that instability. The other thing that we can see is genetics playing a huge role in this as well. If you've ever heard of an OFA certification, this is basically where a veterinary radiologist says that this joint is healthy and the trait is not likely to be passed on to offspring in dogs. Now, the two most common joints in dogs that we see being certified are the elbows and the hip. And we see commonly in a lot of dogs elbow dysplasia, but probably even more commonly is hip dysplasia. And this is where the joint is structured in such a way that the hip joint is not stable under normal conditions. And we get a subluxation, which is where the joint partially pops out of the socket, allowing more movement and instability, leading to inflammation and arthritis. The other condition that often is going to contribute to joint instability is actually obesity. A dog that is obese or weighs much more than they should, or that their body is designed to handle, have that joint instability exacerbated by the excess weight. Think about if you weigh 100% more than you currently do, the forces that are being applied to your joints are going to be dramatically increased. If your joints are made for somebody who's 100 pounds and you weigh 200 pounds, that excess force is all being put into your joints whenever you do anything. And if there is any instability, it's going to push it past that point of instability much more often and with more force, leading to them being more likely to have arthritic changes in the future. I'm not going to mention too much about joint injury or joint infection, as those are less common, and joint instability is probably the primary cause of osteoarthritis in dogs. If you want to learn more about those things, I can leave a couple links down in the description below where you can read about them yourself. So what parts of the joint are going to be affected by instability or affected by arthritis? Well, there's several different areas of the joint are often going to be affected, including the articular cartilage, which is the cartilaginous layer between the bone and the joint. So the actual movement location has articular cartilage that's on top of it, and that cartilage is going to rub with a little thin fluid layer on top of another layer of cartilage. And with arthritis, we can see this cartilage becoming softer, which makes it a lot less slippery and a lot more prone to injury, as well as thinning because of a lack of normal joint fluid production, which we'll talk about in a second, as well as sometimes complete destruction. So there is no cartilaginous layer. And then you get bone on bone grinding, which, as you can imagine, is not pleasant and typically is fairly painful. Now, the second part is subchondral bone remodeling. So the subchondral bone basically just means it's the bone right underneath that articular cartilage layer. And often we're going to see things like bone cysts, where there's a destruction of bone and it's filled in with fluid. Sclerosis, meaning a hardening or a thickening of the ends of that bone. We can also see bone necrosis or death, where there's enough friction or enough damage that the bone itself actually dies, leading to the bone being pushed out into the joint. There's a gap in that layer, contact layer, and every time something scrapes over it, it's going to cause pain and not going to be comfortable for the animal. The other thing that we see a change to is something called the synovium. And this is the tissue layer that produces the joint fluid. It's basically lining the inside of the joint capsule. And we see that this tissue gets a lot bigger and thickening. It also tends to produce less fluid, which is less oiling capacity almost. So if you think about it in automotive terms, having no oil is a bad thing, and it's a bad thing to have very little synovial fluid in a joint as well, as it's going to make all these other things even worse. We also will see the formation of something called an osteophyte or a bone spur. And this is a bony projection within a joint space. These are osteophytes or bone spurs, and they also can be particularly nasty and painful. We also will see damage to ligaments. So ligaments are little fibrous structures that go between two different bones. And we can see formation of enthesophytes. So we talked about osteophytes. Enthesophytes are going to be very similar, as in there's going to be bone actually being formed inside of the ligament. We also can see a decreased movement because of the damage to these ligaments or the increased fibrous tissue around them. They're just not going to move and stretch in the normal way. We also often will see damage to the periarticular muscles. So the periarticular muscles are the muscles that are surrounding a joint. And we can see this because of increased atrophy. So they're going to lose mass, which loses strength, which is going to increase our problem with stability. We also will often see enthesophyte formation on these tendons as well. So a tendon is a junction between a bone and a muscle, and this tendon can also get little bony formations within it as well. Other joint structures that can be affected are tears of things like the meniscus, or weakening of them through inflammation. And this can lead to a decrease in the amount of absorption of shock that can happen within the joint. So that was a lot of information. For the few of you who probably made it through my long rant and raving, hopefully this all made sense. In the next video, we're going to talk about some of the myths and some of the reasons that dogs get arthritis specifically, and not just in general what arthritis is. So stay tuned for that video. And the next video after that, we're going to actually talk about early intervention in osteoarthritis in canine patients. I'm going to make one follow-up video to that where I talk about treating and managing chronic severe arthritis, so in old dogs that are really struggling to move and really don't have a lot of mobility. Thank you guys so much for watching. We will see you in the next video. If you haven't already, hit that like and subscribe button down below. Have a fantastic rest of your day.